Good afternoon, everyone, and welcome to today's podcast, Industry Matters Respiratory Edition here at BGM. I'm Boone Lockhart, VP of Clinical Services, and joining us today is Zach Haynes, Market Development Manager for MyAirvo at F&P. Zach is connected with national clinical research projects, strategic planning, new product development, and customer education, and has been closely involved in clinical implementation of this new therapy, and we're excited to learn more about it. Welcome, Zach.
Awesome. Thanks, Boone. Thanks for having me back.
Well, it's good to see you again. It's been a while since we did our last podcast, but let's just get started at the top. So many of our listeners are familiar with humidified high flow, or HHF, that we'll refer to along in the podcast here. But what exactly is humidified high flow and how is it different?
Yeah, good question. So it's kind of a totally novel therapy, right? Nobody's heard of it yet. It's proprietary to F&P at the moment. It's this new evolution of humidified high flow. So if you think of, traditional therapy, you have symmetrical prongs, right? So the prongs on the nasal cannula are both the same size. On asymmetric high flow, what that really means is that there's one larger prong and one smaller prong. So what that does is it creates this unidirectional flow of air in the upper airway. We have this amazing video that shows a symmetric cannula and the airflow that it creates in the upper airway and the CO2 washout that you get with that versus an asymmetric cannula and what the CO2 washout looks like in the upper airway in that airway model. And just this little small change in the prong size really has this kind of profound effect on the therapy as a whole. So we're really excited about what it means for, high flow moving forward. And and with that too, I should mention that you do get a little bit more pressure and a little bit more comfort with the therapy as well with this new design of cannula. So we're excited about it. I'm happy to talk about it with you today. And looking forward to diving in.
And how long have you had the asymmetric high flow available again? Remind me.
Yeah, it's a good question. So it's been out now for a couple months now. I would say probably 3-4 months at the time of this, conversation.
So it's interesting that the imbalance is intentional and therapeutic, right? You've covered some of that, but what kind of patients may benefit from this approach versus our traditional method?
Yeah, good question. So we think it's going to be kind of the new standard going forward for humidified high flow. Because if you think about it, washing out extra CO2 doesn't really have any drawbacks necessarily, right? So you think about hypercapnic COPD patients, and that's an obvious patient that could benefit from it, right? But really it can apply to anyone, especially if we're talking about comfort, right? If it's a quieter cannula, it tends to it might lead to better adherence and things like that as well. So really anyone, whether that's hypoxemic COPD, hypercapnic especially, but ILD, neuromuscular diseases, all the patients we would normally talk about with humidified high flow could definitely benefit from this.
Regarding the comfort piece on that, one of the biggest challenges with our chronic respiratory support is, you mentioned it, adherence. Have you found that asymmetric high flow improves tolerability?
Absolutely. Anecdotally and early feedback has been really, really positive on that. One of the issues with a lot of positive pressure therapies like CPAP or ventilation or whatever is that pressure and comfort. Patients don't want to feel that on their face. So high flow already, as long as it's high humidity, high flow is typically quite comfortable, especially in the home care space when we're talking about more moderate flow rates. But then you add on a cannula that makes the flow feel even a little bit more natural and is quieter. Absolutely, I think that's going to have a huge impact on adherence moving forward.
Since we met last time, there was some misconception, I would say, in the market. So I know humidified high flow is often confused with oxygen, and that's what was coming out of that. But This isn't just about delivering O2, though, correct?
Yeah, no. In the acute care space, high flow is often talked about with really high oxygen levels, and those kind of go hand in hand, right? COPD patient goes into the hospital with an acute exacerbation, they're throwing on 60 liters of airflow and 100% O2, right? In the home care setting, that's not really the patient we talk about. When I'm talking about humidified high flow, I'm talking about humidified, warm, moist air and airflow, room airflow. Oxygen's just an added bonus. If a patient has oxygen needs, which admittedly a lot of COPD patients do, right? If you look at a lot of the clinical research, there's one in 2018 I talk about all the time. All of those COPD patients were on about 2 liters of oxygen with high flow. So occasionally oxygen can be added on, but that's not really the main benefits that you get out of the therapy. It's more that optimal humidification and the flow, the respiratory support that helps with like dyspnea, shortness of breath, things like that. Yeah.
Regarding the long-term care conversations we've had, humidity seems to come up quite a bit. What's your take on that with this therapy?
I cannot stress how important humidity is. I think we even talked about this a little bit last time, but I talk about this in just about every conversation I have with clinicians because we see far too often the lack of humidity with therapies, and you might be able to get away with that for some, right? I think for like CPAP and bilevel, it is really important to include humidification. And you'll see most CPAP machines and bilevel machines have a built-in humidifier these days. That's because they've adopted this idea that humidity is important, right? But then when you get to home mechanical ventilators, and I'm trying to use that phrasing now with the new NCD and all that stuff, home mechanical ventilators, we will too often see where people are using inefficient humidifiers or HMEs, or just nothing at all, which we've run into a handful of times too. I just want to stress that if you're doing humidified high flow, you have to use optimal humidification or it's going to be a huge disservice to these patients. Whether that is, on a multifunction ventilator that does high flow, or ideally on a MyAirvo 2 at home, humidity is ultra important for sure.
I mean, it doesn't sound very comfortable as a dry air, right?
Oh,
to
that's
that patient's airway.
Yeah, especially if you're talking about if they do have oxygen requirements with this, right? Oxygen is cold, dry gas. So whatever we can do to humidify that and make that a little bit more efficient, then obviously that's a plus for the patient.
Does sizing or any of the high flow settings change at all when using the new cannula?
Yeah, not really. So that's a nice thing is that it's a pretty easy transition to asymmetric high flow. There's 2 stipulations I'll make to that. One is clinicians might find that they can actually use lower flow settings and achieve similar results as they could before using a symmetric cannula. So what I mean by that is because asymmetric high flow tends to do a bit better of a job of washing out that CO2, helping with dyspnea and providing a little bit more pressure, it might mean you can use a lower flow rate and achieve the same benefits. So I don't have like specific numbers for you on that today. That's based off some benchmark studies and some anecdotal evidence at the moment, but it seems to be really promising in that regard. And then 2, sizing, since you brought that up, is ultimately the same. And actually our new cannula, I'll probably mention here in a minute, the sizing is small, medium, large on it, just like our old cannula that we sell. And the only caveat to it is that since you have one larger prong on that cannula and one smaller prong, you just want to make sure you're not creating a seal with the larger prong. It's not designed to be like a nasal pillow for a CPAP machine, right? So for the patient to have the most comfortable experience, you just want to avoid creating a seal with that large prong. But otherwise, everything's the same and it's plug and play. So it makes it pretty easy.
You kind of led me into my next question. Does this require a whole new setup or can the clinicians use their existing devices?
Oh, yeah, good question. So that actually comes up a lot because people see, MyAirvo on something, or they think that our cannulas are specific to our devices or whatever, right? But no, ultimately, any high flow device Again, whether that's a multifunction ventilator, whether that's Miervo 2, it can be an asymmetric humidified high flow device. Of course, I recommend using our high flow device or using our humidifiers especially. However, you certainly could use this if you have a high flow setup that you're comfortable with using today already. Yep.
And we've referred to it as asymmetric high flow cannula here the entire podcast, but what's it actually called?
Good question. So our new asymmetric cannula is called Duet. That is available today, and all of our reps are trained up on it. So, really anyone that's on the call listening today, feel free to reach out to me or your local home care rep. If you're in an inpatient setting and you happen to be listening to this, reach out to your respiratory acute care rep. They're all well versed in the cannula and can help you out if you want to try it out on some patients.
Well, this has been great. Before we go, though, are there any last-minute takeaways for clinicians who might be skeptical or unfamiliar with asymmetric high flow?
Yeah, I'd say just try it. I think it's a really easy way to provide a positive impact for patients. Maybe consider dipping your toes with patients that aren't adherent on other therapies. And if you have a high flow setup already and you're already doing something similar, it's like I said, it's plug and play. So, order a Duet cannula and try it out.
Great. Well, Zach, appreciate you joining me here today.
Awesome. Thanks again for having me, Ben.
Thanks.